I want to show a couple things about how the face ages, and it really has to do with the bones in the face. So what you're going to see here, the orbital sockets, that's where the eyeballs are. This is where the nose is. And then this top jaw and lower jaw is an area where we see a lot of aging. And what happens is when we're young, like about 20 years old, which is what this skull is, the maxilla, that top jaw is very tall with the teeth in it, and the mandible is the same way. There's a lot of substance there, and from the profile, it sticks out because there's a lot of really good, healthy bone there. As we age, what you'll see is when the teeth fall out, this is a dramatic difference. This is more of a 70, 80-year-old. But what you see is that maxilla, or that top jaw, when there's no teeth, just gets smaller. So between age 20 and 80, there's a continual decline in the substance of the maxilla, which is the top jaw, and the mandible, which almost just becomes paper thin, which is the lower jaw. So without teeth, we lose bone. It gets not only thinner vertically, but also from a profile standpoint, the jaw, especially the top jaw, goes way in and really accentuates the aging process. So it's not surprising that as we age and our facial bones get smaller, that our skin has nowhere to go. So what does it do? It kind of falls off our bones. It comes down and in. And that's what the aging process is all about. So it's really a great thing with filler to kind of rebuild the facial skeleton, and then that skin redrapes over the facial bones. Of course, you can do a facelift as well. That's pulling the soft tissues and securing them down to the bone or in stronger structures. But without a good foundation, a facelift by itself is not going to look that great. So consider filler to get your facial structure back before or instead of a facelift.